It's Satoru here from hariQ Acupuncture and Herbs. In this video, I want to share with you about acute Bell's palsy and what you should avoid doing it when you have one. I have noticed that some action could worsen it or cause other complications. So let's go over what you should avoid for smoother recovery. Experiencing sudden paralysis in half of your face can be pretty frightening. I suggest checking out my other blog post, What to Do When You Have a Bell's Palsy. This post outlines 5 simple steps to help speed up the healing process for facial paralysis. So before discussing what not to do, I would like to touch upon Bell's palsy briefly. Bell's palsy is a medical condition that affected the 7th cranial nerves, also known as a facial nerve. The nerve becomes inflamed and swollen, disrupting the signal to the facial muscles. The cause of the Bell's palsy is still unknown, but it's often associated with the viral infections such as herpes simplex. So how long does Bell's palsy last? It's good to know that Bell's palsy is usually a temporary condition, but some people may need a little more time to fully recover than the others. According to studies, about half of people who experience this condition recover fully in a short amount of time. And around 35% of those affected report feeling better within a year or less, which is a great news, but a small percentage of roughly 15% may experience a long-term effect from the condition. Approximately 85% of people who develop the Bell's palsy to regain normal or near normal facial function. However, a group of 15% may need a stronger treatment options. Okay, so what are 3 important things to avoid when dealing with the Bell's palsy? Number 1, exposure to cold and windy environments. Although not scientifically proven, as a licensed acupuncturist, I would like to discuss the concept of Bell's palsy from an Oriental medicine perspective. The ancient Chinese medical text Neijing and Suwen describe this condition, which has been around over 2,000 years. According to these texts, Bell's palsy is caused by the elements of wind and cold, similar to cold symptoms. And in my experience, I have noticed a pattern where some patients develop Bell's palsy immediately after visiting a windy beach or attending an outside sports event. When returning from their trip, they may experience some discomfort or unusual sensations in their face or ears, and the following days, they may develop Bell's palsy. For those reasons, I suggest avoiding exposure to cold and windy environments. It's essential to take caution not only in the winter, but also in the summer due to air conditioning and fans. While modern technology provides us with comfortable living, it can also pose a risk of contracting unpleasant illnesses like Bell's palsy. Number 2, exercises for facial expressions. I totally understand how tough it can be to deal with Bell's palsy. It can be really overwhelming and frustrating, but it's important to know what's really going on. Bell's palsy isn't a muscle issue, it's a nerve issue. Just because you can't move your facial muscle doesn't mean that they're weak. Most likely, the facial nerve has been damaged and inflamed and need time to heal before you can start exercising your facial muscles again. Rushing into facial exercises too soon can actually cause synkinesis, which is when your facial muscles move involuntarily. This can become a bad habit, like closing your eye when you puff your cheeks. That's why it's super important to focus on healing the nerve first. Before attempting any facial exercises, it's important to consult with your specialist to make sure proper technique and safety. Number 3, not getting enough sleep. It's not entirely clear what causes Bell's palsy, but one possible culprit is a viral infection that can take hold when your immune system is weakened. Getting enough rest and sleep is crucial to keep your immune system strong and helping your recovery from the condition. In fact, good sleep is important for overall health, not just for Bell's palsy. If you're having trouble sleeping, it's recommended that you try to make some lifestyle changes to improve your habits. When you consume excessive amount of alcohol or caffeine, it can lead to insomnia. Reducing your intake of these substances and prioritize your current condition, Bell's palsy, will be beneficial. So I hope this video helped you and your loved one who's suffering from Bell's palsy. I look forward to seeing you in my next video. Take care. Bye.